everybody, this is going to be a quick overview. We're going to start off with respiratory disorders. This is part 1 where we're talking about upper respiratory disorders, which will cover rhinitis, rhinosinusitis, pharyngitis, laryngitis, and influenza. So rhinitis is an inflammation of the nasal mucosa, and when we're talking about all these upper respiratory infections, just know pretty much the treatment for many of them are going to be the same. The way they are spread are going to be the same since it's by droplets, and also the duration of them. So the most important thing that you need to be looking at that distinguishes the difference between them is obviously where the actual infection's at. So rhinitis, we're talking about the nasal passages, person-to-person transmissions through droplets, symptoms, runny nose, congestion. Unfortunately, sometimes it can coexist with other disorders like asthma and allergies. When this is the case, they're having histamine release that can lead to capillary leakage, where you have the local edema, some of the swelling, and also sneezing, itchy, watery eyes, sore, dry throat, and possibly a low-grade fever. Times of years can be higher. Typically are going to be the beginning months, the early winter months, and then when school starts, just because students get together and there's a higher exposure and spread of germs. Typically it's viral. Duration should last approximately 10, maybe up to 14 days. Anything beyond that with worsening symptoms, possibly there is a bacterial component involvement, and antibiotics may be used. Individuals who have the herpes simplex virus 1 dormant, anytime they are exposed by certain viruses, they will have a flare-up of cold sores of the HSV1 will increase. Nursing care, rest, increase fluids. Fluids will help thin out any thickened mucus. Encourage the use of home humidifiers, proper disposal of tissues, hand hygiene, ways to cough, and limit exposure to others. Medications, a lot of these, a lot of times are over-the-counter antihistamines. When we think of things like Benadryl, you have to consider what your patient population is. Older individuals, you need to watch for sedation, vertigo, hypertension, urinary retention, since some of them have anticholinergic-like effects. Decongestants can constrict blood vessels and decrease edema. Nursing consideration with this, specifically this is talking about nasal decongestants, say like Afrin, to avoid prolonged or excessive use because it can lead to rebound nasal congestion. Decongestants overall, like oral ones, can raise a person's blood pressure, so they should be avoided in those that have hypertension. Intranasal glucocorticoid sprays are most effective to prevent or treat seasonal and perennial rhinitis. Antipyretics like Tylenol to manage fever, and antibiotics only if bacterial infection can be identified. Sinusitis or rhinosinusitis is going to involve the sinuses. Usually will typically end up causing a sinus infection because of the swelling of mucosas that block the drainage of secretions. So a lot of times these individuals in the long term will be treated with antibiotics. It's going to be the same symptoms as rhinitis plus facial pressure, pain when the head is tilted forward, bloody or purulent nasal drainage, tenderness of palpation of the forehead's orbital and facial areas. Nursing care is going to be the same as rhinitis, plus discourage air travel, swimming, diving. Encourage somebody to stop smoking because it can aggravate and inflame the sinuses there, and sinus irrigation and proper use of nasal sprays. Medications, nasal decongestants, talked about that earlier. it should be encouraged to be most effective during the first signs of manifestations. Pain relief can include anything from NSAIDs, acetaminophen, or aspirin. Know that aspirin should be not used with children or teens simply because the combination they have found with use with any viruses can possibly lead to RHI syndrome. And broad-spectrum antibiotics like amoxicillin for confirmed bacterial infection, unless somebody has a contraindication or allergy to penicillins. Sinus irrigation, and you will want to give your patients clear guidelines that to contact their primary care physician if they start to notice a severe headache, neck stiffness, which is known as nuchal rigidity, a high fever. That could be a possible complication of meningitis or encephalitis, because what happens is the pathogens will actually enter the bloodstream from the sinus cavity. Pharyngitis, inflammation of the pharynx, cause can be viral, others are bacterial. Usually see it in acute cases of those that are less than 25 years old. Chronic cases usually has a lot to do with environment and behavior factors like alcohol and tobacco use. If it's viral, you're going to see fiery red pharyngeal membranes and tonsils. See like white exudate. You're going to have tender and enlarged cervical lymph nodes, no cough. You might see fluid coming from the tonsils and a fever, malaise and sore throat. And again, medical management is all going to be based exclusively on the cause. Laryngitis, this is basically when somebody loses their voice. Causes vary. It can be anything from voice abuse to environmental exposure or an upper respiratory infection. A lot of times hoarseness is some of it, sudden onset, and it can be aggravated by cold, dry wind. Throat usually feels worse in the morning, and it can improve as the day goes on, or when somebody's indoors in warmer climate, and it can worsen again in the evening hours. A person has a tickle in the throat that is made worse by cold or liquid, and chronic laryngitis is marked by persistent hoarseness. So basically, rest your voice, avoid irritants, and inhaling cool steam. Influenza, this is usually an epidemic in the fall and winter months. It is transmitted by droplets. Adults are contagious 24 hours before manifestations, up to 5 days after they begin. Manifestations: severe headache, chills, fatigue, fever, diarrhea and cough. Antivirals are given within 24 to 48 hours after onset of symptoms. These antivirals used amantadine, rhamantadine, ribavirin, xanaminiferin, my goodness, and also Tamiflu, which is Tamiflu. Droplet precautions are needed for hospitalized patients. Monitor hydration status. Prevention obviously is going to be best. Hand washing. Encourage those over 6 months and those with a history of pneumonia, chronic medical conditions, pregnant or over 65 years old, and healthcare professionals to get vaccinated. Those who do have egg allergy should avoid the vaccine injection, just because the vaccine is made from egg protein, and the big complication that we're concerned about is pneumonia. So just to kind of review, make sure you understand the different types of medications, over-the-counters that patients typically use for upper respiratory infections, because most of them are caused by viruses. The big thing with this is managing symptoms, because that's basically what makes us feel absolutely horrible. So antihistamines, Decongestants that helps relieve nasal congestion. Example, and this is an oral, which is pseudoephedrine. Again, this should not, certain decongestants should not be used with individuals with hypertension because it can raise a person's blood pressure. Nasal decongestants, like the sprays, should be used as directed, not overused or for long periods of time, since it can cause rebound congestion. Antitussives are cough suppressants. Cough suppressants are best for patients who are having a dry, hacking cough that is non-productive. Expectorants actually help bring mucus up and other material from the lungs and trachea. An example is guanfacine or Mucinex, and expectorants are going to be more beneficial for patients who have a more productive cough. So just kind of be mindful to when, say, a cough suppressant should be used versus an expectorant. Trauma obstruction of the respiratory airway, so we're going to talk about OSA. Make sure you know what defines it as a presence of at least 5 obstructive events per sleep. Risk factors, those who are going to be heavier, overweight, have a history of diabetes, but OSA definitely puts a person at an increased risk for heart attack and stroke, and it may also increase insulin resistance. So OSA and diabetes is not a good combination. Again, manifestations: frequent and loud snoring and breathing sensation for 10 seconds or longer for at least 5 episodes per hour, followed by awakening abruptly with a loud snort as the blood O2 levels drop. The way that it's diagnosed is through anecdotal recounts from a patient and a sleep study. Link between heart disease and OSA. There have been shown that there is a link of hypertension, and as I said before, too, over time, OSA can lead to stroke and MIs. Medical management, weight loss, avoiding alcohol and hypnotic meds, because again, alcohol and hypnotic meds relax muscles and can increase the occurrence of obstruction. Sometimes an oral appliance is used to reposition the mandible or tongue if that is what is causing the obstruction, but outside of that, non-invasive positive pressure ventilation is used. CPAPs are used for individuals who can breathe independently, where BiPAPs are often used for those that require some ventilator assistance at night, like those with severe COPD or central sleep apnea. Other medical managements, they can do surgery, and they can use some pharmacological therapies that basically you either have a stimulant that basically helps a person stay awake during the day, or triptyl, which can help increase respiratory drive and improve upper airway muscle tone. And the big thing that nurses need to do is to educate patients, like why they need to be wearing their CPAP mask. Say, hey, you don't want to die of a stroke or heart attack, so wear it. I'm sure you'll find a more therapeutic way to say that, but sometimes direct is best, and encouragement for compliance. Epistasis, nosebleeds. There are a lot of different risk factors. What you need to be able to do is how to educate a patient to properly treat a nosebleed. And then once you talk to them about treating it, make sure they know what to do to avoid, to try to prevent future nosebleeds. Laryngeal cancer, most common symptoms going to hoarseness. Surgery, there is a complete removal of the larynx, so patient will lose their natural voice. So a lot of times they will then have a tracheostomy. So remember that if that person is in distress, that the O2 is going to be delivered through the stoma here. And that's about it. That's about 15 minutes. If you have any questions, you know how to reach me.